Bitcoin supera el hito de los $20,000 según su valor.
Teacher, good afternoon.
Hi, Liz. Hi, Liz. Good afternoon. How are you?
Hi, teacher. Good afternoon. I'm pretty good, thanks. And you?
How is everything?
It's okay. Today was a kind of relaxing day.
I
and
think
you?
it's cloudy there.
More or less.
Or not?
1 hour ago was raining.
Yeah. Okay. Here it's not raining, but it's a little bit cold and cloudy.
Mm-hmm.
I hope the rain won't come. Okay. Yeah. Okay, Liz. We're gonna talk about yesterday's class, and I wanna ask you, which kind of drugs do you usually use at the hospital the most?
Paracetamol.
Okay. It's like acetaminophen, right?
It's the same.
Okay. And for which uses?
For pain, the most common is, I think, is the most common use. Have you seen the memes on Facebook or wherever social media that say paracetamol?
Yeah. I know, it's the most common.
Yes, it's because it's the most cheaper and cause minor damage in our bodies. For example, ibuprofen, when you take more than 3 days, you can start to have problem. So that's we use paracetamol or acetaminophen more usually.
Which kind of problems? Renal or liver problems?
More renal. As
Okay.
ketorolaco 2, for example. You can use for 3 days and then you can cause damage, renal damage.
Okay, thank you. And can you describe a prescription for this medication? Maybe for, I don't know, for any disease you want.
Okay, for example, you have to take 1 tablet of acetaminophen each 8 hours per day for 1 week.
Okay. And it is usually used when children have a fever, right?
Yes. In
it
adults,
works?
yes, it works. But I think that you have succeed when you use the correct doses. For example, I have seen that some colleagues give only 1 tablet. Each tablet has 500 milligrams.
Yeah.
So if you take only 1 tablet, you won't feel nothing. But if you give 2 tablets, I mean 1 gram, that's the correct doses. The same cases is with kids. We use when the kids have fever, because when we use ibuprofen in kids, it's not recommended. And so you have to use the correct doses. For example, you can say just give 1 teaspoon, because this is not the correct doses for the weight of the kid. So you have to calculate the correct doses, and you are gonna have good results.
Okay, and it's on suspension for kids, right?
For
Or
suspension,
you
yes.
can, okay, and I want to know, it's not like antibiotics, right? But if you get just 1 pill, you can feel better. And it doesn't matter if you don't take the other ones, or you have to take the whole treatment that doctor said.
For example, if you have a flu, one example, maybe you can take 1 pill and then you can feel better, and that's all. But for example, if you have a small surgery, you have to take all the treatment, because it's a tissue that is recovering. So if you don't take the treatment, the complete treatment, when the effects passed, you are gonna feel pain again. So that's why you have to complete.
Okay, thank you. I completely understand. Okay, and let's talk about endoscopies. Okay, endoscopy surgery has become popular. How important is it in surgery?
Um, well, I have 2 points of view about that, because the first one is very useful and is not as invasive as a surgery. So you can have a diagnosis more easily, and you can have a big idea what is the problem in the stomach, for example, what is happening in the stomach. So I think it's very, very useful. Here in my city, we use full, but the other point of view, some doctors are doing with this tool like commercially, because maybe some patient go to the consult and say, I have a stomach ache, I have too many problems, I don't eat well, and the doctor immediately say, okay, you have, or you must have to do endoscopy. And not all the patient needs. We have like protocols, or we have criteria to choose who patient needs or not. And some doctors give endoscopy for everyone.
Wow.
That's not good.
Yeah. For example, in which cases do you recommend endoscopies?
For example, when a patient have a very long time with gastrointestinal problems, stomach ache, but not stomach ache like, for example, when you eat something and then you feel wrong. Stomach ache, that in Spanish we call dolor tipo urente o quemante, como quemazón,
Okay.
like your stomach burn. So, for example, in that case, we use that. We first we recommend omeprazole, and then if the patient don't feel good in a few weeks, then we recommend an endoscopy.
Can we call that the initiation of gastroenteritis?
I think gastroenteritis is when some food make you wrong, make some damage in you.
Okay, just in that case, right?
Well, then, or for example, when you the most common case when the patient have gastric ulcers, definitely you have to use you make the endoscopy.
I thought the first step was the burning pain in stomach, then the gastroenteritis, and then after that, it was an ulcer. I don't know. Is it procedure
Yeah,
or
more or
not?
less. But like I was telling you, gastroenteritis, I think is when some food is make some damage. So we don't use endoscopy for that. We only use antibiotics. I think the first case is gastritis in English.
Yeah, gastritis is the same.
Gastritis. Okay,
Yeah.
so gastritis is the first case.
Okay.
Then ulcerative colitis, and then gastric ulcer.
Okay. So I think I thought I was thinking on that, and I told you gastroenteritis.
Like gastritis.
Yeah.
Okay.
Okay. So let's talk about two contrasting therapies you have experienced and advantages and disadvantages of each.
What therapist teacher?
Contrasting therapies.
Okay. Um,
Which one
the
have you experienced? If not, just you can make an example.
the contrasted what was it? I don't remember.
Contrasting therapies. It refers, maybe in some cases we use the endoscopy, right? And in some cases we use the surgery, and that are contrasting each
In
other.
the meaning in Spanish, what would be?
Terapias de contraste.
Ah, okay. Contrast. Okay. um, I have seen. I never do that because this kind of therapies are made by a specialist. But I have seen one case. The patient couldn't pass the food. For example, the solids. Definitely, he can't pass. And when he drank water, he felt too many pain.
Wow.
So the doctor decides to do a kind of contrasted therapy, and it's kind of the doctor gives like a special liquid with contrast. It calls barium contrast, or barium, I don't know. And while the patient drink it, a machine is like taking pictures in live how is the esophagus. So we saw the patient had a problem in the third space in esophagus. I mean, at the end of the esophagus. So esophagus should be like a tube like this.
Yeah.
And after that, at the end, we have the stomach. And in this part, he has like a pencil, like was totally closed.
Okay.
And that's why the food don't pass.
Okay, like a valve?
Yes, like the valve was not collapsed, but was very, very close and didn't open. So the food just accumulate and didn't pass to the stomach. So I think what's a good method to have a diagnosis, but it's not too much, it's not common. A ver, no se usa comúnmente this method Don't use
not
commoners.
is not usually used.
That's right. It's not usually
Okay.
used.
Okay, just one thing, and it was good your example, but contrasting therapies, it's when you compare one therapy with another, and contrast therapy is what where you were saying.
I always give you examples with another topic.
No, but it's okay. It's okay. It's almost referring to that, and I know sometimes we can just think about another things.
But maybe we can compare. So, for example, tomography and resonance. That's right.
Yeah.
Well, you know that the both are very useful. Give us a very good imagine that what is happening with our bodies. But I think the difference, the huge difference, would be that the resonance don't have or doesn't produce many damage in the patient. I mean, with the radioactive
Yeah.
radioactivity. Uh-huh. I think that's a huge difference. So
Okay.
the
So
both are very, very useful. The both. Tomography and resonance, we use a lot to see tumors, for example, or some liquid that maybe in ultrasound or in X-ray we can see. The difference, I think, will be that.
okay. Okay, that was good. Okay, I will send to you my questionnaire, but I think she's not gonna come yet, Salome, so we can still talking about some other topics.
What method do you use in your job?
Just X-rays, nothing else for now. But if I want to make a surgery, maybe with implants, but I'm not a specialist on that. People use a tomography, which is better. Yeah, but I don't like implants. So.
So what do you like?
What especially?
Uh-huh.
Okay, I'm salubrist.
Yeah. I remember that you told me. Yes, yes, yes.
Yeah, I like that the most. But if you make me choose, I like I don't know, periodontist too. Maybe something that is with the tissues, with the mouth, but not with the structures, osseous structures. So, but it's so beautiful, I think. But I really don't like.
It's like it's beautiful, but I don't like.
Yeah, it's not my way. I enjoy doing some projects, health politics, and that kind of things. I
And you're
really,
working on that right now?
yes, I work on a foundation, but because it's a foundation, it's so hard to be there. And we are trying to get a financial help. So we are making a lot of projects. It's so beautiful that you don't get money as much as you want.
Yes, especially that in Latin America, the government don't give money easily for that things.
Yeah, that's right. And we were like meeting by meeting last few weeks and presenting our projects. I don't know what is going to happen, but okay. I think I hope it would be. I don't know. Someday I hope to work with people and with these projects because they are beautiful. I
Yes, but
think.
if you try to look some programs, international programs, I think they will go ahead.
Yeah,
They could help.
yeah. That is a good idea. and we were thinking to present to some collaboration areas of some maybe Swiss or Italy or
Mhm.
some kind of help or cooperation. And
Yes.
I don't know, but we're gonna still fighting for that. But
Yes.
it's not as rentable as an implant, for example.
Yeah, that's true. Actually, the wife of my brother, she is endodontist.
Oh yeah, that's pretty nice too.
Yeah, and I see that she wins very good.
Yeah, that's a good career, but if you like to do and wait for patients and stay at your consultation, it will be better.
And actually, you have to be able for any emergency.
Yeah, yeah,
So,
that's right. At
mhm.
any time of night or day or wherever. Yeah, that's right.
And the most common, I have seen that the pain only appears at night.
Yeah, that's so weird and uncomfortable, but it's the truth.
Yeah.
I don't know.
I was reading an article because I want to understand why happened that, and I saw that the article stated that when the people sleep, we're lying in bed, and then the blood comes more to the head.
Yeah,
So that's why the vascularization,
vascularization. Yeah,
vascularization increase. So the pain are more stronger.
increase too.
Uh-huh.
That's right. And because of the maybe I don't know, maybe people has some damage on their tooth and it makes compression and
Mm-hmm.
really painful. People want to get off his or her heads, so we have to do something about.
Yes. I remember that in my rural year, I had patients that come at 2, 3 a.m.
Yeah,
and was like, okay, what can I do for you? And the patient told me, I have a tooth problem and it's too much painful. And I couldn't do nothing, just give any treatment like an injection and nothing more because we don't know that.
an injection. What? Which kind of injection?
For example, ketorolaco, that we have that.
Okay, it was so hard, but certain. Okay, that was.
Yes, and we can do more.
Yeah, I know. I know. Especially in those places where maybe even if there is no a dentist, there are nothing else to do with them because you don't have the skills or the tools to use either. So
Yes. Even if I have the tools, I don't know what
you
to
don't know
help
how to
you.
do it, of course. I remember on those months in rural
Mhm.
places, I work as a, I don't know what I was doing because there was a patient with an epileptic problems, okay, and
Mhm.
I was just getting out from the university, and I have to take care of her, and I had to take her tooth because she was in pain, and it was so crazy. I was just sweating a lot. Uh, I I I don't know. I wanted to cry, but I just couldn't.
Yes.
And I hope and I prayed for her not to get an epileptic episode because it would be so terrible.
Yes.
Yeah. And with the light, I didn't have the right light. It was such a bad experience.
But you did it.
Yeah, I did it. Oh my God. I don't know what happened with Salome.
Yes, it's not coming.
So weird.
She didn't tell you nothing?
No. Oh my God. Okay, Liz. Thank you very much. So see you next week.
Okay, teacher. Have a good weekend.
You too. Take care.
You too. Bye, teacher.
Bye.